So why is early diagnosis of Marfan syndrome so critical in the context of the aorta?
Well, it is preferable to detect problems early in medicine, and particularly in a genetically driven disease like Marfan. If we can identify that the patient has got a Marfan and we diagnosis, and we can examine the aorta, then we can plan to intervene and stop the aorta expanding any further uh, at an early stage and do a much simpler operation, which, in other words, an operation that carries a lower risk and lower morbidity. Likewise, if because of Marfan, uh, the aortic or the mitral valve, or possibly both valves, are beginning to leak, the earlier that we can detect that, the more simple it is to repair the valve. If you can repair the valve and keep your own valve, that's the best solution. But if things are allowed to go on for 10 years or more before any action is taken, the disorganization of the valve may be such that it's not possible to get a good repair, and then you have to replace it. We've got very good valves for replacement, but they're not as good as your own valve, because the choice is either between a valve that's very durable, but for which you have to take lifelong anticoagulation with warfarin, or a biological valve, which is very satisfactory early, but after about 15 to 20 years, it will degenerate and need replacing. So if we can repair valves, that's by far the best solution, provided we can get a good durable repair, because we've intervened early before the valve is very, very disorganized. So those are the reasons, I think, why early detection of Marfan is important.